Chest pain is a sensation of discomfort experienced anywhere from your upper abdomen to your lower neck. This discomfort can manifest in many ways. Some people describe it as a sharp stabbing feeling. Others report a dull ache, a burning sensation, or a feeling of pressure like an elephant sitting on their chest. The pain might be constant, or it might come and go. It can also vary in intensity from mild and nagging to severe and debilitating. Understanding these variations is the first step in trying to figure out what might be causing it, which is a crucial piece of the diagnostic puzzle for medical professionals. The experience of chest pain is highly subjective. What one person describes as mild discomfort, another might find unbearable. Its character can also offer clues. For instance, pain that worsens with a deep breath might point towards a different set of causes than pain that occurs after a heavy meal. The location of the pain, whether it's central on one side or radiates to other areas like the arm, jaw, or back, provides further important information. Healthcare providers rely on these descriptions to narrow down the potential underlying issues, as chest pain is not a disease itself but rather a symptom that something is amiss within the body, signaling a need for further investigation. It's important to remember that chest pain is one of the most common reasons people visit the emergency room. This is understandable given its association with potentially life-threatening conditions, particularly those involving the heart. However, not all chest pain signals a dire emergency. Many less serious conditions can also cause discomfort in the chest area. The challenge lies in distinguishing between these varied causes. Factors such as your age, medical history, lifestyle, and any accompanying symptoms all play a role in the diagnostic process undertaken by medical teams when you present with this concerning symptom. Therefore, defining chest pain goes beyond a simple dictionary definition. It encompasses a wide spectrum of sensations and potential origins. It is a signal from your body that warrants attention. While it can be alarming, a systematic approach to evaluating the pain, considering all possibilities, is key. This approach helps ensure that serious conditions are identified promptly, while also providing reassurance and appropriate treatment for less critical causes. The body often communicates its distress through pain, and chest pain is a particularly potent message that should never be ignored or dismissed without proper medical assessment to determine its true significance. When chest pain arises, concerns about the heart are often foremost in people's minds, and for good reason. Cardiovascular causes are among the most serious. Angina, for example, is chest pain or discomfort that occurs when an area of your heart muscle doesn't get enough oxygen-rich blood. It might feel like pressure or squeezing in your chest. Stable angina often occurs predictably during exertion and subsides with rest. Unstable angina is more dangerous. It can occur at rest, is more severe, or lasts longer, signaling a higher risk of a heart attack. A myocardial infarction or heart attack involves the death of heart muscle tissue due to a prolonged lack of blood supply, often causing intense, crushing pain. Other significant cardiovascular conditions can also manifest as chest pain. An aortic dissection is a medical emergency where the inner layer of the aorta, the large blood vessel branching off the heart, tears. This can cause sudden, severe, and often described as tearing or ripping chest or back pain. Pericarditis, an inflammation of the sac surrounding the heart, the pericardium, can cause sharp stabbing chest pain that may worsen with breathing deeply or lying flat, and often improves when leaning forward. These conditions require immediate medical attention, as they can be life-threatening if not diagnosed and treated rapidly, underscoring the urgency of evaluating severe chest pain. The lungs are another major source of chest pain. A pulmonary embolism, PE, occurs when a blood clot, usually from a leg vein, travels to the lungs and blocks an artery. This can cause sudden, sharp chest pain, often accompanied by shortness of breath, a rapid heartbeat, and sometimes a cough, which may produce bloody sputum. PE is a serious condition that can be fatal if not treated promptly with blood thinners or other interventions. The severity of symptoms can vary widely depending on the size of the clot and the overall health of the individual, making it a challenging diagnosis at times. Pneumonia, an infection that inflames the air sacs in one or both lungs, can also cause chest pain. This pain is often described as sharp or stabbing and may worsen with deep breaths or coughing. Other symptoms typically include fever, chills, cough, often with phlegm, and shortness of breath. Pleurisy, an inflammation of the pleura, the tissues that line the lungs and chest cavity, can also cause sharp chest pain that intensifies with breathing, coughing, or sneezing. These conditions, while often treatable with antibiotics or anti-inflammatory medications, highlight how respiratory issues can directly lead to significant chest discomfort, requiring careful medical evaluation to ensure proper management. The gastrointestinal system is a frequent, though often less alarming source of chest pain. Gastroesophageal reflux disease, GERD, commonly known as acid reflux, is a prime example. This occurs when stomach acid frequently flows back into the tube connecting your mouth and stomach, esophagus. This backwash can irritate the lining of your esophagus, causing a burning sensation in the chest, often referred to as heartburn. Symptoms may worsen after eating, lying down, or bending over and can sometimes be mistaken for heart pain. Antacids or more potent acid-reducing medications often provide relief for this common ailment. Other esophageal issues can also mimic heart-related chest pain. Esophageal spasms, which are uncoordinated contractions of the esophageal muscles, can cause sudden, severe squeezing chest pain that may last from a few minutes to hours. It can sometimes be difficult to distinguish from angina. Peptic ulcers, open sores that develop on the inside lining of your stomach and the upper portion of your small intestine, can also cause burning stomach pain that may radiate to the chest. This pain is often influenced by meals, sometimes improving and sometimes worsening after eating, depending on the ulcer's location and type. These conditions, while uncomfortable, are generally manageable with lifestyle changes and medication. Musculoskeletal problems are another common culprit behind chest pain. Costochondritis, an inflammation of the cartilage that connects a rib to the breastbone, sternum, can cause sharp localized chest pain that is often tender to the touch. The pain might worsen with movement, deep breathing, or coughing. Muscle strains in the chest wall, perhaps from heavy lifting or strenuous exercise, can also lead to soreness and pain that can be mistaken for something more serious. Typically, musculoskeletal pain can be reproduced by pressing on the affected area or by specific movements, which helps differentiate it from cardiac pain. Finally, psychological factors can play a significant role in the experience of chest pain. Panic attacks and severe anxiety can trigger chest tightness, palpitations, shortness of breath, and a terrifying sense of impending doom. These symptoms can closely resemble those of a heart attack, leading to considerable distress and emergency room visits. While the heart itself may be healthy, the physical manifestations of anxiety are very real. Other less common causes include shingles, which can cause a painful rash on one side of the chest if the virus reactivates along a nerve path. These diverse origins underscore the complexity of diagnosing chest pain. While many causes of chest pain are not life-threatening, it is crucial to recognize the warning signs or red flags that may indicate a serious underlying condition. These symptoms demand immediate medical attention because time is often critical in treating conditions like a heart attack or aortic dissection. Ignoring these alarms can have devastating consequences, leading to irreversible damage or even death. Therefore, understanding these red flags is not just informative, it can be life-saving. It empowers individuals to act decisively when faced with potentially dangerous symptoms, either in themselves or in others around them. Key red flags for chest pain include sudden onset of severe, crushing or squeezing pressure in the chest, pain that radiates to the jaw, neck, one or both arms, especially the left, or the back is particularly concerning. If the chest pain is accompanied by shortness of breath, profuse sweating, diaphoresis, nausea or vomiting, dizziness, lightheadedness, or a sudden feeling of intense weakness or fatigue, these are all signals that something serious might be happening. A rapid or irregular heartbeat alongside chest pain also warrants urgent evaluation. Any loss of consciousness associated with chest discomfort is an absolute emergency. If you or someone you know experiences chest pain with any of these red flag symptoms, do not try to wait it out or diagnose it yourself. The most prudent course of action is to call emergency medical services immediately, such as 911 in the United States. Emergency responders can begin assessment and treatment en route to the hospital, which can be critical in improving outcomes for conditions like heart attacks. Driving yourself or having someone drive you might delay necessary medical intervention, and if your condition deteriorates, it could lead to an accident. Professional medical help is essential in these acute situations. In conclusion, chest pain is a symptom that should never be taken lightly. While its causes are diverse, ranging from benign to life-threatening, the potential for serious underlying disease means that prompt evaluation is always the safest approach. By understanding the potential causes and critically recognizing the red flag symptoms, you can make informed decisions that prioritize health and safety. Medical professionals are equipped to differentiate between the various causes of chest pain through careful history taking, physical examination, and diagnostic tests. Seeking their expertise without delay is paramount for accurate diagnosis, appropriate treatment, and ultimately, peace of mind or life-saving care.